Welcome to Healthcare Signs and Symptoms, a show where we explore the interdisciplinary field of healthcare and medical research. Tune into the bi weekly conversations with UOHS as we cover the latest topics in science healthcare news. My name is Nicole Chu, and today I'm joined with Tanya Lee.
Today we'll be talking about COVID-19 testing in Canada. And before we get started, we're just going to have a disclaimer that we're not experts. We're just having an open conversation about COVID-19 as undergraduate science students, about topics in science and what we believe should be addressed. We'll be outlining the testing information required by the Ottawa Public Health as of October 28th, 2020, and we will attempt to demystify any fears surrounding this topic.
Yeah, definitely. So, COVID-19 testing has definitely been a popular topic in news and media, and I'm sure everyone knows about the importance of going to get COVID-19 tested. So, before we start and delve into the actual experience of COVID-19 testing, why don't we first lay out the basics? So, why should one get tested? So, the four main reasons listed by the Ottawa Public Health to go seek COVID-19 testing include one, if you are exhibiting any COVID-19 symptoms. So, for more clarifications of these symptoms, I'm sure that you guys can just search up COVID-19 symptoms and go to Ottawa Public Health to find more details. And furthermore, a second reason to go get tested is that if you have been exposed to anyone that has been confirmed a positive case or has been notified by the COVID-19 Alert app or Ottawa Public Health authorities to go get tested if you were in contact with anyone who demonstrated symptoms with COVID-19. Moreover, a third characteristic is that you have been part of a workplace that has been infected by COVID-19 or has had an outbreak recently. So, due to community transmission, you may have come in contact with someone who tested positive. So, under these circumstances, it is best for you to go test it as well. And the last reason is quite a niche reason, but if you are chosen to be part of a government initiative targeted to testing a certain group of people, so for instance, the elders in a retirement home, if you were chosen to be part of this group targeted by the Ministry of Health, then you would also want to go get tested. So, if any of these reasons apply to you, make sure to head over to Ottawa Public Health website and book an appointment as soon as possible at your local healthcare testing center.
Okay. For the next part, we're just going to be talking about like how pharmacies also are a new place to get tested. So this is relatively new since before we used to just have, I think, 5 or 4 testing centers in Ottawa. But with
Yeah, definitely.
pharmacies, oh, go ahead.
Oh, yeah. So, definitely, pharmacies present like a much more convenient way to go get testing. And if Tanya, you can also explain how um, testing has opened up more recently to pharmacies across Ontario.
Oh yeah, sure. So, since they've opened up to a lot of pharmacies across Ontario, a lot of people who probably couldn't get tested before or had difficulties can go get tested now. So it begun around September, like around the end of September, around the time the school year started, which is good since a lot of kids are going back to school. I know a couple of my siblings in high school are going back to school, and there was actually cases in both their schools.
Yeah, definitely. I feel like schools and children, just putting them all in contact with one another is definitely the prime place to spread a sickness like COVID-19.
Yeah,
So,
like oh
mhm.
yeah, like I live near a kindergarten, like an elementary school, and I pass by all the time, and they're not wearing any mask and like running around. I'm like, oh god, like the kids might spread it really easily because they're really like touchy with each other.
Yeah, definitely. And there's not really that much emphasis placed on like washing your hands. Well, I guess that's the only emphasis placed in schools that they can really do to prevent the transmission. They can't really enforce kids to wear masks, especially since they're so young. And I definitely think that opening pharmacies across Ontario presents a much better and safer opportunity for people to go get tested because they no longer have to line up for hours on end in front of like a local testing center, being exposed to like potential people who carry the virus. But it's also important to note that these pharmacies across Ontario are only offering testing for asymptomatic individuals. So that means like people without symptoms. So for instance, if like one person had exhibited symptoms like coughing or sneezing, then they would not want to go to a local pharmacy. You would want to actually book an appointment at your local testing center.
I remember there was like a pamphlet that they give you when you do get tested, and it was like just a checklist of whether you should get tested or not. And a lot of the reasons why like people who are asymptomatic want to get tested is because they just like feel unwell. It might just be like a placebo effect, or they just want to know if they have it, like if they're maybe going to visit like an elderly like relative or something. They just want to make sure before going up and seeing them just in case, but they don't have any symptoms. So I think having the pharmacy is like a really good idea. Like people might just be there anyways to pick up prescriptions, and they're like, okay, might as well get tested. I have heard from my friend who works at a pharmacy that the lines are long because I feel like it gives people a lot more freedom to be tested because anyone can go if they don't have a symptom, which is most people.
Yeah, that's so true. And actually, the opening of pharmacies was part of the government's plan to minimize the second wave of COVID. But as you said, since it's just starting out in pharmacies, I'm sure they're still trying to figure out the organization system. So I'm sure like people who are going right now to pharmacies, they definitely probably have to wait a long time because there's still so many precautionary measures that they're trying to figure out. And the thing you said about the placebo effect is so true, especially right now due to COVID-19. Probably a lot of people are anxious and they might think that they have like COVID-19 when in reality it could just be like a common cold. So pharmacies definitely present like an opportunity to easily go get tested.
Yeah, like sometimes like some symptoms might come from just like stress. Like they might be like, "Oh, I think I have a fever," or like, "I think I have a sore throat, so maybe I have like COVID." Like I was definitely like that too before I got tested. I was like, "Oh my god, I might have it." Like I wouldn't like I haven't done anything like potentially to expose myself to COVID, but like you never know, that kind of thing. Like anyone can get COVID, not just people who like party or purposely go to big public events. Like it could just happen anywhere.
Yeah, and people could be asymptomatic, meaning that they don't even exhibit any symptoms and just carry the virus. So it's definitely so scary. And we have that spectrum of people, right? We have the people who don't care at all about COVID, and then the type of people who are super careful. And that also brings up another point of the people who are super careful. They want to know if they have it or not. So then they want to get tested as soon as possible and they snatch up any opportunity to go get a testing appointment. And this brings us to our next point of appointment based testing and the empty slots in a lot of these COVID-19 testing centers. So lately in Ontario, Ontario, as of October 4th, has discontinued any walk in testing services. So, therefore, all COVID-19 assessments have to be booked online via appointment slots. So, we've also been, like, Premier Doug Ford said that these appointment only systems for COVID-19 clinics would help reduce the lineups, as with similarly the pharmacies, which is used to like reduce the lineups and the um, people in front of the testing clinics.
I think like it has personally like reduced lines at testing clinics, but also the empty slots is a problem because sometimes I feel like it is too empty in my opinion. Like
Yeah, definitely. Like on the news, they've been saying like a lot of people have been booking up multiple slots at different testing centers in order to get the quickest testing appointment available. But in doing so, they're booking up valuable slots that could be used and reserved for people who really need it. And if these people don't cancel their booked up slots, then these slots just go to waste. So there are a whole bunch of empty slots in these appointments at different centers that are just basically being wasted because people are booking up so many and not going to them.
yeah, and it definitely sucks for people who like have a tight schedule. So maybe they're only available for like an hour that day or an hour that entire week just to go get tested. But that slot's taken by someone who just wants to get tested as soon as possible, but books like multiple slots. So it's definitely a problem. Like,
Yeah,
yeah.
definitely. And I feel like it's also preventing the testing centers from reaching their maximum capacity. I remember back in September or back in June when COVID-19 testing just started, testing centers were reaching their maximum capacity like 1 hour after opening or like really soon after opening. But now, due to these empty slots, they haven't been really able to test as many people as they've projected to, right? So that's
Mhm.
really limited the ability of the testing centers to test like lots of people to prevent this community transmission sort of thing. And it also messes up the organization system of the centers, right? If they like hire a whole bunch of testing people and only like one or two people actually show up for the appointment, I feel like that's definitely very wasteful of the time that could be used.
Like it exposes them less to people, but I feel like they're ready to test people, like ready to help everyone like prevent the spread of COVID. So when they come into work and then there's a lot of different people, like they expect a lot of people to come and only like a couple show up, it kind of just like shows how some people like just book and then don't remember to cancel it, which is bad because they should take it a bit more seriously, just because a lot of people are waiting for appointments and might not have the available time to be tested at different days or different times.
Hmm. Yeah, and I definitely think like taking up these testing slots at multiple different locations across, let's say, Ottawa, is definitely preventing people who truly need to be tested. For instance, they're truly like exhibiting symptoms from getting like the opportunity to be tested. So that's definitely like an issue to remember if you are choosing to go get tested, to make sure to only book one appointment if you need to, and make sure that if you can't make your appointment, to cancel before the scheduled date. And this will help Ottawa Public Health and all the organizers make a much more efficient testing process for everyone else in the city. So,
Hmm.
speaking of testing, I've actually never gone tested. Tanya, have you?
Yes, I've been tested twice. Both
Well,
negative though.
wow. Actually, like we wanted to share our experiences and, well, maybe Tanya's experience and maybe my expectations as someone who has never gone COVID-19 tested before. So I can start off because I've never actually gone to COVID-19 testing because I've actually never been in contact with anyone and I've never really needed to. So I have some pre-existing, I guess, misconceptions that I was wondering if you could help demystify.
Yes.
Yeah, I feel like for someone who has never gotten tested before, the whole process just seems like really foreign and kind of scary for me at least.
I think
Mhm.
at the beginning, like there was a lot of lineup. Like when I first got tested, it was around August, I think. So COVID testing was still high, and the centers are only open from 9 to 3 o'clock, and that was when I was working like at 9 to 5. So I was like pretty stressed
Oh.
about the time, but my employer was like, "It's fine, please get tested. Like
Yeah,
stay healthy, stay safe." The lineups were long. Like I did hear about other people who try to get tested, and like I know, for example, like my roommate, she tried to get tested. She came at like 10 a.m. and she waited until like 3 o'clock to actually like get a test. Like she was the last person they were gonna accept, even though she was like waiting for hours.
wow. I actually didn't know about that. I thought like if you just went, like then you could be able to go get tested.
Like
I
you
didn't know
can't.
that they. Mhm.
Oh no. I was just gonna say like you can't get tested. It's just the lines are like extremely long.
Wow. Yeah, I remember just when COVID-19 began to become prominent in Ottawa, like testing centers were so packed and like people who wanted to go get tested couldn't get tested because they didn't meet the requirements at that time. But I feel like right now, due to like the more we have more testing kits available, like definitely more people have been able to go get tested. In terms of your testing experience, what was sorry, what was it like before like the testing? Did you have to book an appointment or anything?
So for the first time I got tested, I didn't have to get an appointment. It was back in August before they did appointment-based testing. And so as soon as I found out that I potentially could have been exposed to someone with COVID, I went to a testing center. So it was the Brewer Park one near Carlton. And surprisingly, I think it's because of the day I went, like it was in the middle of a weekday or something. There wasn't that much of a line. Like I probably waited like 15 minutes, which isn't bad at all. Like which is really good.
Mhm. Yeah, that's so fast compared to what you said earlier about waiting like hours on end.
Yeah, I think for like higher like days where people have more time, then they'd probably want to get tested. And so then that's what makes the lines like move up. But when I got tested, it was like pretty chill. They ask you for your info and like health card, all the basic stuff. If you're displaying like any symptoms, so they do kind of like a little screening thing where they ask you, do you have any symptoms? Have you been exposed to anyone with COVID? And then once you answer all the questions, they print out a paper for you, and then you just go to like a booth, I guess, and they stick something up your nose. So I think it's like the nasal swab, and it kind of hurts, not gonna lie, but it's not
Whoa.
bad. Like just to know the results, like it's obviously worth. But I do know people who have like cried or teared up while getting that, just because it goes in really deep. It's like a long stick.
Wow, that's kind of scary. Yeah, I feel like one of like my well, not really misconceptions, but one of my fears was that it was gonna be really painful. Like just have something up your nose. Like that sounds so uncomfortable.
It was
And
definitely
just like
uncomfortable.
you said. Mhm.
Mhm. But I know for like, I think more serious cases, like my friend who did get rushed to the hospital, she had to do a blood test as well. So,
Whoa, that's so unique.
yes.
But I feel like the blood test is definitely for more extreme cases, right?
Yeah, she was like showing like heavy symptoms. Like, I think she had like a really high fever. She was like fainting, coughing, sore throat. And I've seen her like a few
Whoa.
days recently. So I was pretty stressed because it was my first time. And I was like, oh God, because I saw my family also recently, so I was afraid that they could have potentially been exposed. So the wait for getting my test results was definitely painful.
Whoa, it must have been, you must have felt so much anxiety during that time. Like, I can't even imagine what waiting for the results feels like.
Yeah, I got my results after, like, I got tested with my roommates, and they got their results back before I did. So I thought, and theirs was negative. So I was thinking, okay, if mine's taking like longer, does this mean I potentially tested positive? So the wait was stressful.
Wow. And you said you went tested twice, right? How did the second test differ from the first one? Or was it like pretty similar?
The second test was for a different reason, so I actually got sick on my own. Like I woke up
Oh,
with kind of like a fever or a sore throat, and so what I did was I live like near campus, so I live in Sandy Hill, and there's a testing center that opened I think back in September or October for U Ottawa students and staff at the Lee's campus. So I found that a lot more convenient just because for me going to Brewer Park near Carlton took me over an hour,
wow.
and if I'm sick, I really don't want to potentially expose people on the bus. So it would have been harder for me. So I'm glad they have that center open. So it was actually a very like easy process. You just go on the website, you enter your student number, and you book a time. And then you just go. And it was very empty. Like I was the only person there at the testing center other than like the actual testing people, but the only person being tested at that time. And then there's only one other person who came after me. So I feel like the lineups have definitely shrunk.
Whoa, that sounds very different from your first experience of going to like the community testing center. So do you have any like words of encouragement or anything to people who might want to get tested or are going testing soon?
I think that like if you're nervous most of the time, like unless you've like even if you do test positive, I don't think it's the end of the world. Like not everyone who tests positive are people who have been like partying or out excessively. Like it could just be like people who maybe only go out for groceries and they potentially get it, or people who just work because they need to. So don't feel bad. if you haven't done anything to like try to get COVID. And testing is a lot more accessible now, which is nice. So I wouldn't worry too much. Just work with whatever works with your schedule, because I feel like the times are a lot more flexible now with pharmacies and also like the U Ottawa specific testing center. And then there's also the testing center near Carlton and just around the community.
Do you have any last words for any people who are really anxious to get tested
I think
or are
like
waiting of the results?
I think while you wait for the results, it should be okay. Like they say, for me personally, they told me like 5 to 7 days, like business days. So I thought that was gonna be a long time, but most of my results came back within like 2 to 3 days. Um, it might take longer, but during the wait, I feel like it's best not to think about it too hard to the point where you're stressed and then maybe get like very anxious about it, since you've gotten tested, and unless you've done something like something that you know would have potentially gotten you like COVID, like maybe gone to a very big party or something, then you should be fine. I think most everyone I know so far has tested negative in my experience. And like most, for me, if you just like work part time or go out for groceries, it should be okay. Like don't feel bad if you do get it, but also if you don't, then it's a relief.
Wow, thank you for sharing your experience. And for anyone else out there who is currently feeling super anxious or they might be waiting on their results, as Tanya said, it's okay. Take a deep breath. The Ottawa healthcare authorities will be there for you. If you get tested positive, don't worry. Don't feel guilty about it. And even if you test negative, take this as like a grain of salt. It might be like a false negative, and still be careful. And before we go, show some love for your favorite podcast, Healthcare Signs and Symptoms, by leaving us a review on Apple Podcasts or a review on Spotify. And head to our UOHS website where you can read our blog posts and also tune into our weekly podcast. Our next week podcast topic will be focusing on obesity and the closing of gyms due to COVID-19.
Thank you for listening, everyone.
Thank you. Have a great day.